After dislocating his kneecap, there were concerns that Patrick Mahomes could potentially miss the entire season, but his MRI was reportedly very reassuring, and we've already seen him return to Chiefs practices. Welcome back, everybody, to your #1 source for learning about everything related to sports injuries and sports medicine news. In today's video, we're going to take a look at the sort of long-term risk and chances of having another kneecap dislocation centered around Patrick Mahomes. I'll touch on some of the things the Chiefs will do to try to minimize his chance of having another dislocation during these upcoming games, and then we'll talk about some different anatomic risk factors that we know predispose someone to having repeat dislocations. Make sure and go subscribe if you like this type of content and want to stay up to date with future videos, and let's get started. If you haven't seen it yet, I encourage you to go watch my first video talking about this injury, because in this video we'll expand on some of those concepts. Right off the bat, why do we even care about the potential risk of having another patellar dislocation? A lot of it comes down to potential damage to the cartilage underneath the kneecap and in that groove where the kneecap slides in the femur. Remember that groove in the femur called the trochlea that the kneecap slides back and forth in when you bend your knee? Well, that and the patella are covered with cartilage. Most of the time on just your first patellar dislocation, there's actually some trauma and injury to that cartilage on the kneecap. As the kneecap gets forced out laterally, it basically just smashes into the femur and causes extra impact and potential damage to the cartilage. So if it doesn't happen the first time that you dislocate your patella, each subsequent time that your patella comes out, you have increased chance of causing cartilage damage, which then predisposes you to earlier arthritis. A lot of the research is going to tell us there's a repeat chance of dislocation around 20 to 40%, but this is over the course of many years, not just in that first week or in that first year. This is oftentimes over around 10 years or so of duration. So what things matter when it comes to your risk of having another dislocation? The first and probably most obvious one is the condition of those specific ligaments that are holding the kneecap in place. We talked in the last video about this MFPL, or the medial patellofemoral ligament, being one of the primary stabilizers of the kneecap. Without actually seeing Mahomes' MRI, we have no way of knowing how much damage there's been to this ligament. Certainly if it's just been stretched, then that's much better than if it were to be completely torn. If it's completely torn, there's not as much stability and there's further chance of it dislocating. Two of the risk factors we can assess with Mahomes right away are his age and his gender. Younger people are more prone to recurrent dislocations, as well as females compared to males. The exact age depends on the paper you look at, but oftentimes some of the cutoffs are below 18 or below 25. I think Mahomes is 24, and so he's sort of in this younger range where he's going to be at a higher risk of having a dislocation compared to someone who's 30 or 40. The next risk factor has something to do with the actual position of the kneecap. If the kneecap is sitting higher up, closer to the quadriceps muscles, we call this patella alta. If it's further down lower to the tibia, we call this patella baja. Patella alta, meaning your kneecap is higher up, increases your chance of having recurrent dislocations. This risk factor, along with the next two I'm going to discuss, we have no way of knowing just by looking at Mahomes. But these are things that his doctors can tell by looking at his MRI and looking at his X-ray, so they do have a better sense of what his recurrent dislocation risk is going to be. Going back to my first video, remember that patella has a tendency to want to shift out or shift lateral, hence where it dislocates. And so these next two risk factors have to do with the ability or tendency of the kneecap to move in that position. The first is any sort of malformation of the groove that the patella slides in. We call this trochlear dysplasia. The deeper your groove, the more grip, so to speak, that the patella is going to have to stay in that space, as opposed to if your trochlea is really flat, then there's not going to be as much contact protecting the kneecap, and it's going to have a higher tendency to pop out. The last one to talk about is something called the space between the tibial tubercle and the trochlear groove. We've talked about the trochlea already, and the tibial tubercle is the bump on the shin bone that the patellar tendon inserts into. In general, this location's a little bit to the outside of the groove that the kneecap is riding in, but the further that it's shifted to the outside, the higher your risk of having another dislocation. And this should make sense intuitively. If we take the attachment point for the patellar tendon and we pull it further to the side that the kneecap wants to dislocate, then now suddenly there's going to be even more of a tendency for the kneecap to want to snap out of that groove and dislocate. So these are things we have no way of knowing, but have certainly factored into the doctor's decisions on what he should do going forward. But in the meantime, we're going to see Mahomes wearing a brace on his knee to help provide stability to that kneecap. The most often one we talk about is a patellar J brace, and we call it a J brace because the support around the kneecap looks like the letter J. There's essentially a bar or a rigid support that kind of encloses the outside of the kneecap and then goes around the bottom to provide some stability to keep that kneecap from moving to the outside. Again, everything we're doing with these braces is trying to keep the kneecap in place. So whether or not it's putting support around the kneecap, putting one of these J braces where you're just bracing the outside of the kneecap, it's all trying to keep that in its proper groove. At the end of the day though, if he ends up at the bottom of a pile or he gets hit or has some similar mechanism, those braces are gonna do some, but they're ultimately not gonna completely diminish that risk. I think it's also a pretty good possibility that if he makes it through this season without another dislocation, that he considers having surgery in the off season to really decrease that risk of having another dislocation during his playing career. That's it for the video though, everybody. I hope you guys learned something and enjoyed watching this one. Let me know any questions or comments down below. And until next time, thanks for watching and I'll see you later.